Today we'll be talking about the radioactive contamination accident in Goiania, Brazil, and its impacts and response. Our objective is to examine the circumstances, health impacts, and management strategies that occurred in Brazil in 1987, and specific objectives are to understand the events leading to the incident, explore the health effects and consequences, and discuss the radiation protection measures and medical interventions. Table of contents include map of Brazil showing contamination, health effects, and use of Prussian blue in the treatment, cytogenetic analysis, and guidelines for patient discharge. So, a brief history on the incident. On September 13, 1987, two thieves stole a radioactive device containing cesium-137 from an abandoned clinic in Goiania, Brazil. The radioactive capsule was eventually sold to a scrap dealer, continuing the spread of the contamination, which was up to about 100 kilometers away from Goiania. Thousands of people were screened and hundreds were found to have been exposed to radiation externally and internally. To clean up houses were demolished, soil was removed, contaminated areas were covered with concrete. However, radiation levels remained in some areas even after cleanup efforts. From the map, Goiania is located in central Brazil, about 930 kilometers northwest to Rio de Janeiro and 930 kilometers southwest of Sao Paulo, where these are the major cities where radioactive materials are used in medical and industrial applications. The contaminated area shown in the map illustrates how far the radioactive material spread within the city, and even affected areas up to 100 kilometers away due to wind and rain carrying these particles. So the health effects of this accident are bone marrow depression, which is about 6% of individuals experience bone marrow depression. This condition can lead to a decrease in production of blood cells, which are essential for body's immune system and oxygen transport. 3% of individuals developed acute radiation syndrome, characterized by symptoms like nausea, vomiting, and fatigue due to high radiation exposure. And 11% developed local radiation injuries like radiation burns and tissue damage, leading to skin burns and tissue destruction. And 42% of individuals developed internal contamination, which was the most prevalent one because the materials were absorbed into the body, and this can occur through inhalation, ingestion, or skin absorption of radioactive substances. And remaining 38% had no significant impact. The first two pictures, we see people undergoing monitoring for cesium contamination at the Olympic Stadium in Goiania. After the radiation accident, authorities screened individuals to check if they were exposed to radioactive cesium, and the stadium provided a safe space for this monitoring process. The third image shows the radiation-induced injury on someone's thigh, which developed 25 days after exposure to radioactive material, and this radiation can cause damage to skin and tissues, resulting in visible skin lesions or burns like the one shown here. In the fourth picture, we observe a large blister on the palm of the hand caused by radiation exposure, where skin cells are damaged by radiation. They can form blisters which are filled with fluid. To counter this contamination, Prussian blue was administered. During the incident, many individuals were exposed to cesium both externally and internally, which complicated their medical treatment. Doctors used a medication called Prussian blue to help remove cesium from the bodies of affected individuals. This was a significant step because it was the first time it was actually used in radiological accident. It was administered to about 46 people who were contaminated with cesium. Adults received a dose of around 1 to 10 grams per day, and children received an initial dose of 1 to 1.5 grams per day. The graph shows two parts, part A and B. Part A shows administration of 10 grams of Prussian blue per day, And this part of the figure depicts what happens when a higher dose of Prussian blue is given to a patient. Y-axis likely represents the content of the cesium in the body, while x-axis represents time. As we move along x-axis, we'll see a decrease in the content of cesium in the body due to administration of Prussian blue. Higher dose of Prussian blue results in more rapid decrease in cesium content in the body, where part P is after cessation of Prussian blue administration. This part shows what happens after the administration is stopped. We likely see that without ongoing Prussian blue treatment, the rate of decrease in cesium content in the body may slow down or reach a plateau. Therefore, this figure demonstrates that higher doses of Prussian blue leads to faster removal of cesium from the body. Cytogenetic analysis. This figure presents a histogram showing the frequency distribution of estimated radiation doses for individuals contaminated during the accident. X-axis represents different dose levels in grays. Y-axis shows the number of individuals corresponding to each dose level. The peak of the histogram indicates most common dose range received by individuals. The histogram shows that 21 people received estimated doses exceeding 1 gray. Among these, 8 individuals had estimated doses exceeding 4 grays. No individual had an estimated dose exceeding 7 grays, as shown by the absence of bars beyond this point on the histogram. And the guidelines for the discharge of patients are: the table provides maximum allowable in-body radioactivity levels based on age and time since exposure to cesium. The time since exposure is indicated in days, and the table lists different age groups from newborns to adults. Patients are considered for discharge if their in-body activity levels are below the specified values in the table for their respective age and time since exposure. Additionally, the mean radioactivity level of urine should be less than 15 kbq per liter for discharge criteria to be met. And finally, the summary is Goiania radioactive contamination incident resulting from improper handling of the stolen goods. And these health effects include bone marrow depression, acute radiation syndrome, local injuries, and internal contamination. Treatment included administration of Prussian blue to mitigate internal contamination. Cytogenetic analysis played a crucial role in dose estimation and patient management. Strict guidelines were to be followed for the patient to be discharged from the hospital, and the lessons learned emphasized the importance of proper handling and disposal of the radioactive sources, as well as the need for effective emergency response and medical interventions in radiological accidents. These are the references. Thank you.